Hey, it's Elliot. So I just filmed the first half of my ADHD video, or the first part, but I was hitting a time limit where I was like, I think I'm gonna roll over to the next video. I was talking about ADHD, and I'm still talking about ADHD. I'm still looking at the DSM-5 in front of me. If you didn't watch the first part, I'd really recommend you watch that part first before you watch this, because I'm really just picking up exactly where I left off. In that last video, I talked about what is ADHD. I went over the DSM criteria. I'm still looking at the DSM, but the DSM is the diagnostic it basically is the diagnostic manual for all sorts of types of mental health issues, neurodevelopmental disorders like ADHD, trauma stuff. There's a whole lot. The DSM is really interesting to look at it. But I'm going to go now into differential diagnoses, so things that are similar or that you might have alongside of ADHD. I probably should have stopped after reading the criteria and then started, but whatever. Because I'm probably going to do, comorbidity and differential diagnoses, and then I'm going to start going into my report, so some of my really specific things, either in this video or the next one, because I don't want to do more than 25 minutes on each video. So differential diagnoses, so things that may look similar to ADHD or may be seen alongside ADHD. The first one is, and I'm still looking at the DSM. Ooh, sorry. And I'm gonna try to we'll see if I get to putting these things that I'm saying on the screen. So the first one on here is oppositional defiance disorder, and here's the DSM. Individuals with oppositional defiant disorder may resist work or school tasks that require self-application because they resist conforming to others' demands. Their behavior is characterized by negativity, hostility, and defiance. These symptoms may be differentiated from aversion to school or mentally demanding tasks due to difficulty in sustaining mental effort, forgetting instructions, and impulsivity in individuals with ADHD. So there's a difference between ODD and ADHD. So it's not, so with ODD it's kind of oppositional defiance, whereas ADHD is kind of more avoidance. Complicating the differential diagnosis is the fact that some individuals with ADHD may develop secondary oppositional attitudes towards such tasks and devalue their importance. And I believe it is possible to have, because ODD is kind of often a precursor to conduct disorder, and you can definitely, I was talking about in my last video, that some individuals with ADHD will also go on to develop conduct disorders and antisocial personality disorders, so you can definitely have ODD and ADHD. The next one is intermittent explosive disorder. ADHD and intermittent explosive disorder share high levels of impulsive behavior. However, individuals with intermittent explosive disorder show serious aggression towards others, which is not characteristic of ADHD, and they do not experience problems with sustaining attention as seen in ADHD. In addition, intermittent explosive disorder is rare in childhood. Intermittent explosive disorder may be diagnosed in the presence of ADHD, which means you can be diagnosed with both. Other neurodevelopmental disorders. The increased motoristic activity that may occur in ADHD must be distinguished from the repetitive motor behavior that characterizes stereotypic movement disorder, in some cases of autism spectrum disorder. So ADHD has a different type of the movements is what they're talking about. And so kind of repetitive movement disorder, which I also have. I also am autistic. So rocking and flapping, things that are very, and there's an overlap, but there's a difference. And it's about to go into that. In stereotypic movement disorder, the motoric behavior is generally fixed and repetitive, e.g., body rocking, so, rocking. I'm in a chair, my desk chair in my room kind of rocks, which is great for me. Self-biting, whereas the fidgetiness and restlessness in ADHD are typically generalized and not characterized by repetitive stereotypic movements, so those like repetitive motions. In Tourette's disorder, frequent multiple tics can be mistaken for the generalized fidgetiness of ADHD. Prolonged observation may be needed to differentiate fidgetiness from bouts of multiple tics. So I don't know that much about Tourette's. I'm actually going to go ahead and recommend that you go check out Tics and Chicks. I'm going to link them down below. Kelsey has Tourette's, and her friend talk about it. And I'm sure there's plenty of other people out there with Tourette's that on the interwebs they can tell you about it. There's a lot of misunderstanding about Tourette's out there. So I recommend you go check out Tics and Chicks because I don't want to even try to explain Tourette's, and I know that that's a resource that's out there. Specific learning disorder. Children with specific learning disorder may appear inattentive because of frustration, lack of interest, or limited ability. However, inattention in individuals with a specific learning disorder who do not have ADHD is not impairing outside of academic work. And there is an overlap between those two. So having a learning disability or disorder or learning differences might appear similarly to ADHD. Wow, I'm like, okay, so hashtag expanding mast cell reaction while doing this video. Fun times. Focus. The next one's intellectual disability, then in parentheses, intellectual developmental disorder. Symptoms of ADHD are common among children placed in academic settings that are inappropriate to their intellectual ability. In such cases, the symptoms are not evident during non-academic tasks, similar to the learning disorder. So ADHD is present all the time across tasks, whereas if it's a learning thing, it's going to be present specifically talking about academics or learning. A diagnosis of ADHD, an intellectual disability, requires that inattention or hyperactivity be excessive for, I'm just reading mental age. Mental age is a whole controversial concept, but the way they assess ADHD is different in someone who has an intellectual disability is basically what they're saying. I'm not saying I'm not, I just wanted to mention that not everybody is super thrilled about the concept of mental age. The next one is autism spectrum disorder, which I have. I don't know what that was. Individuals with ADHD and those with autism spectrum disorder exhibit inattention, social dysfunction, and difficult to manage behavior. The social dysfunction and peer rejection seen in individuals with ADHD must be distinguished from the social disengagement, isolation, and indifference to facial and tonal communication cues seen in individuals with autism spectrum disorder. For me, and for one, it was actually a little bit like part of I think why it was longer to diagnose my autism is because, I'll talk about this when I talk about autism, but like there's such overlap between the two and the communities overlap significantly, so you can see things like stimming in both communities. There's a lot of people have both, so they have similar but different and they're related disorders. They're highly related. They're very similar, and your risk for one goes up with your risk for the other. So like family patterns, so like one person might have autism and another person might have ADHD, and it's a similar, they're not entirely sure why. It's just an interesting thing to know. Children with autism spectrum disorder may display tantrums because of an inability to tolerate a change from their expected course of events. So like a meltdown. I had one last night because of that exact thing. In contrast, children with ADHD may misbehave or have a tantrum during a major transition because of impulsivity or poor self-control. So similar presentation, overlapping disorders, but inherently different. Reactive attachment disorder. Children with reactive attachment disorder may show social disinhibition, but not the full ADHD symptom cluster, and display other features such as lack of enduring relationships that are not characteristic of ADHD. I don't know a lot about reactive attachment disorder, so I'm not going to go into this. Anxiety disorders. I have a really pretty severe anxiety disorder. ADHD shares symptoms of inattention with anxiety disorders. Individuals with ADHD are inattentive because of their attraction to external stimuli, new activities, or preoccupation with enjoyable activities. This is distinguished from the inattention due to worry and rumination seen in anxiety disorders. Restlessness may be seen in anxiety disorders. However, in ADHD, the symptom is not associated with worry and rumination. So, like, fidgeting and being restless and, like, worried restless are different. And I personally have both, and they look, even in me, very similar at times. And it's interesting. Depressive disorders. So I have in remission of depression. Individuals with depressive disorders may present with inability to concentrate. However, poor concentration in mood disorders becomes prominent only during a depressive episode. Pretty self-explanatory. Bipolar disorder. Individuals with bipolar disorder may have increased activity, poor concentration, and increased impulsivity, but these features are episodic, occurring several days at a time, so like not constant. In bipolar disorder, increased impulsivity or inattention is accompanied by elevated mood, grandiosity, and other specific bipolar features, so like mania, I think is what they're talking about. Children with ADHD may show significant changes in mood within the same day. So for a while, my ADHD, it was like diagnosed, but for the first couple of years of my like mental health treatment, I kept having like mood disorder, not otherwise specified, because of my like mood lability. But it makes a lot of sense in context of ADHD. Such lability is distinct from a manic episode, which must last 4 or more days to be a clinical indicator of bipolar disorder, even in children. Bipolar disorder is rare in pre-adolescence, even when severe irritability and anger are prominent, whereas ADHD is common among children and adolescents who display excessive anger and irritability. And the next one, disruptive mood dysregulation disorder. Disruptive mood dysregulation disorder is characterized by pervasive irritability and intolerance of frustration, but impulsiveness and disorganized attention are not essential features. However, most children and adolescents with the disorder have symptoms that also meet criteria for ADHD, which is diagnosed separately. Substance use disorders. Differentiating ADHD from substance use disorders may be problematic if the first presentation of ADHD symptoms follows the onset of abuse or frequent use. Clear evidence of ADHD before substance misuse from informants or previous records may be essential for differential diagnosis. So, and this is true for a lot of disorders in the DSM, is that substance use disorders, depending on what the substance is, can like mimic or parallel a lot of different things. So they often have to just like be like, so how much of it was already there and how much of it is the substance use, and that's complicated by the fact that you're at a much higher risk for substance use disorder if you have really a lot of things, especially if they're undiagnosed or untreated or poorly managed, like self-medication's a thing. Personality disorders. In adolescents and adults, it may be difficult to distinguish ADHD from borderline, narcissistic, and other personality disorders. All these disorders tend to share features of disorganization, social intrusiveness, emotion dysregulation, and cognitive dysregulation. However, ADHD is not characterized by fear of abandonment, self-injury, extreme ambivalence, or other features of personality disorder. It may take extended clinical observation, informant interview, or detailed history to distinguish impulsive, socially intrusive, or inappropriate behavior from narcissistic, aggressive, or domineering behavior to make this differential diagnosis. So I actually had, for a while, it was borderline symptoms, and then it was borderline personality disorder diagnosis. But looking back, it makes much more sense that I have ADHD and autism as opposed to borderline. But women and AFAB and girls, so I'm AFAB, assigned female at birth, people are much more likely to be diagnosed with things like borderline or depression or anxiety, whereas men and assigned male at birth folks are much more likely to be diagnosed with things like conduct disorder and ADHD and like autism, because part of it's the internalizing versus externalizing presentations, and that's a whole complicated thing, but it's worth noting. Psychotic disorders, ADHD is not diagnosed as the symptoms of inattention and hyperactivity occur exclusively during the course of a psychotic disorder. Makes sense. Medication-induced symptoms of ADHD, symptoms of inattention, hyperactivity, or impulsivity attributed to the use of different medications, are diagnosed as other specified or specific, as other specific or unspecified, other or unknown substance-related disorders. So, neurocognitive disorders. Early major neurocognitive disorder, dementia, and or mild neurocognitive disorder are not known to be associated with ADHD, but may present with similar clinical features. These conditions are distinguished from ADHD by their late onset. ADHD starts in childhood. Things like dementia and neurocognitive disorders usually don't present until much later in life. And then the next part is comorbidity. So these are disorders that you might often see or are more likely to see in people with a disorder, one disorder than without. So things that are more common in people with ADHD than without, or are relatively pretty common. In clinical settings, comorbid disorders are frequent in individuals whose symptoms meet criteria for ADHD. In the general population, oppositional defiant disorder co-occurs with ADHD in approximately half of children with the combined presentation, so combined type of ADHD. So about half of the kids with a combined type, half of children with combined type ADHD also have oppositional defiant disorder, and about a quarter with a predominantly inattentive presentation. So even with inattentive, about a quarter, the kids with that type of ADHD also have an oppositional defiant disorder. Conduct disorder, which is more related to ODD, but it's like adolescent onset, more severe. It occurs in about a quarter of children or adolescents with a combined presentation depending on age or setting. So about a quarter of children and adolescents with combined ADHD have conduct disorder as well. A lesser percentage of children with ADHD, I skipped ahead. Most children and adolescents with disruptive mood disorder have symptoms that also meet criteria for ADHD. So mood dysregulation is a big thing in ADHD that's not really talked about a ton. So things like when you have disruptive disorder, mood dysregulation disorder, so people with disruptive mood disorder, a majority also have ADHD or meet criteria for ADHD. A lesser percentage of children with ADHD have symptoms that meet criteria for disruptive mood dysregulation disorder. So ADHD is comorbid with disruptive mood dysregulation disorder, but that's not necessarily the reverse, I think. Specific learning disorder commonly co-occurs with ADHD. Anxiety disorders and major depressive disorder occur in a minority of individuals with ADHD, but more often than in the general population. So it's not like a high comorbidity, but it's higher than in the statistical average general population. And I think that's more common in women and AFAB folks with ADHD. Intermittent explosive disorder occurs in a minority of adults with ADHD, but at rates above population levels. Although substance use disorders are relatively more frequent among adults with ADHD in the general population, the disorders are present in only a minority of adults with ADHD. In adults, antisocial and other personality disorders may co-occur with ADHD. Other disorders that may co-occur with ADHD include obsessive compulsive disorder. I have that. That's actually, they're finding more and more is more related to ADHD and autism than it is to anxiety disorders. tic disorders, and autism spectrum disorder. And then there's like some other types of ADHD, or like disorders underneath the same umbrella. So other specified attention deficit hyperactive disorder, which is applies to presentations in which symptoms characteristic of ADHD that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate. But basically, you have some symptoms and it's interfering with your life, but you don't meet full criteria, so you'll have other specified. This other specified attention deficit hyperactive disorder category is used in situations in which the clinician chooses to communicate that the specific reason that the presentation does not meet criteria for ADHD or any specific neurodevelopmental disorder. This is done by recording this is just telling the DSMs used by diagnosing professionals, followed by like why, so like with insufficient attentive symptoms. And then there's unspecified ADHD. Applies to presentations in which symptoms characteristic of ADHD that cause clinically significant distress or impairment in social, occupational, or other important area of functions predominate but do not meet the full criteria for ADHD or other neurodevelopmental disorder. It is used in situations in which the clinician chooses not to specify the reason that criteria are not met. And includes presentation in which there's significant information to make a more specific diagnosis. So like the other specified ADHD is like, well, okay, so we know, like, here's why. Or unspecified is like, you just don't quite meet criteria. So I'm gonna end this one here. So we're doing it on the fly. So this is part 2 of the ADHD diagnostic criteria. I find DSM fascinating, and I think the best way to kind of describe ADHD is to tell you what's it defined as officially. So then there's some more stuff, and I'm gonna go over some of like that stuff in the next parts. Not sure how long this is gonna be. I'm gonna film it all at once, but I'm probably gonna edit it and it'll come out slowly. This is part of why it's taken me so long to get to talking about it, is because there's so much and I wanted to really do it justice. And my planning abilities are impaired by my ADHD. So, I finally didn't have anything I had to do today. This Saturday, the past couple Saturdays, I've been very busy and I haven't really put out any new videos lately, at all. But, so, let me know if you have any questions about anything that I talked about in this video and the other video, and, stick around, cause, well, I don't know, that doesn't make sense. I'm gonna go film them talking about my ADHD now. Bye.